Welcome back to ABC 7 at 4. I'm Mark Ross. August is both National Eye Exam Month and Children's Eye Health and Safety Month. And bringing this all into focus, ABC 7 medical contributor Dr. Ogechika Alozie with Sunset West Health. Of course, Dr. Alozie wears glasses. I do too. And they say the eyes are the window to the soul, but you know, your eyes are critically important. How serious a problem is vision disability?
You know, it depends on how serious it is to you, right? We all have that friend that should be wearing glasses and refuses to use them, right? They can't see on their phone, they can't see when it's time to pay a bill. But if you look at the data, about 35% of people are at risk for some sort of serious eye issues. And the question is, what does that mean? Usually it's eye issues so bad that they cannot drive, they cannot see without natural light, and really they can't see without glasses. The problem here, and we've talked about this before, is that about half of those people have visited a doctor. That means there's 50% of those people that have never even seen a doctor.
How often then should someone have their eyes checked?
So the way I look at it is really easy. Just say once a year. Right? So kids are a little bit different, but you should have for your child, and we'll talk about that a little bit later, an early eye exam, and then again, check them again when they hit somewhere between 3 and 5. But after that, you should really be checking your eyesight every year.
What should you expect if you've never gone for an eye exam? What should you expect to happen?
Right, so there's a chart that we all know. We've seen it in malls, we've seen it in movies. It's called Snelling's chart, and it really looks at how well can you see, right? So depending on how well you can see those letters at each size and each line, it tells you whether you're 20/20, 20/40, 60/80, whatever the numbers may be. They'll check your eyes and see whether they dilate properly, cover your one eye and see whether you're left eye or right eye dependent, confrontation, color blindness. That happens mostly in men, and I'm partially colorblind. Then they'll do a refraction analysis, right? They'll really check, okay, so if you can't see well, how do we get you to see well? And then other things like glaucoma, diabetes, hypertension, these can all affect the back of your eye. And the slit lamp and the applanation tonometry can affect that.
Of course, the refraction is they're saying, okay, what's clearer, number 1 or number 2?
Exactly.
All right, let's talk about children's eye health and safety. What are the risks for children developing vision problems?
Well, I think one of the things is that just like speech, vision affects childhood development, right? If a child cannot see, they can't really figure out what is around them in the world, and that affects their hand-eye coordination, how they walk, right? So then what are the risk factors, right? If you have a child that was born earlier than 32 weeks, if they have a host of conditions, whether it's Downs or a host of genetic conditions, and if they have an eye injury, either just from chemicals at home or trauma. Sometimes it happens during sports. And so all those kids, should definitely get checked out.
And of course, you know, if the kid's sitting in the back of the classroom and is squinting to see what's up front, that should be a warning sign for the parent.
Yeah, that was me. That was me sitting in the back in middle school and elementary school even, and being too cool not to go up front. I think we have different challenges in this generation though, the iPads, the phones, right? Not necessarily that you shouldn't use them, but there should be a limit, right? They say 20 minutes, look at something 20 feet away for 20 seconds, and kids touch and put everything in their mouths, try to keep those hands clean. Don't go overboard with it, but again, soap and water is fine.
And make sure they get checked. This is a real key thing here.
Absolutely, and so we talked about that early checking, right? So the American Optometric Association, I bundled that one, says that at least before the age of 1 they should be checked, and thereafter, sometimes start again between the ages of 3 to 5 and check every year. Once they're going into school age especially, to avoid being that kid in the back of the class that can't see and then tunes out on school, get them checked.
All right, we have some resources for adults and children alike here.
Yeah, so obviously El Paso Children's Hospital, we're blessed to have a children's hospital, and so they're all obviously awesome. But I think it's also important to call out other organizations and clinics that do some of this work. And whether it's the Children's Eye Center of El Paso, Buena Vista Eye Care, or Southwest Eye Institute, get checked regularly, and don't be ashamed if you start to get older and you can't see. That's just the natural aging process. And again, we talked about diabetes and hypertension, smoking, all of those things can affect your vision. Get checked, see better.
ABC 7 medical contributor, Dr. Ogechika Alozie, thank you very much, sir.
Thank you, sir.